Hello everyone. I am Dr. Savitra Bandari. I am a pediatric neurologist at JFK University Medical Center located in Edison, New Jersey, USA. I see patients from birth to 21 years of age with all neurological conditions. Today I am going to talk about children's mental health. So first we will talk about some information about the brain development. So brain development starts very early in pregnancy within first few weeks. Then nerve cells we call neurons rapidly grow, connect with each other and form the networks. So after birth the brain grows very fast, especially in the first 2 to 3 years of age. And when child goes through experiences like talking, touching and bonding, that helps to strengthen the brain connections. So positive interactions like caring, loving, communicating and playing with child, that supports the healthy brain development. So early childhood is very critical period for learning emotion, social skills and language. So why children's mental health matters? So children's mental health is not a future issue. It is happening right here and now. So mental health is as important as physical health in children. We as a parents, we always focus on physical health of child, whether he's growing tall, he's gaining weight, he's healthy, but we might not be aware of the child's mental health. So it affects how children think, how they feel, how they behave, how they learn, and how they interact with others. So small conversation today can prevent big problems tomorrow. So for that, awareness is very important. And children are not going to tell you like, I'm struggling or something like that. You have to guess based on their behaviors. So strong children are not those without problems, but those who feel supported and understood. So around 1 in 5 children may have behavioral or emotional issues. And by age of 16, nearly 4 in 10 children may be diagnosed with some mental health conditions like anxiety, depression, or attention deficit hyperactivity disorder. So common problems include anxiety, ADHD, and behavioral issues and mood disorders. So the brighter side of this condition is most of these conditions can be detected early and treated well. So that's why awareness is very important. And early help improves outcome significantly. And of course, parents play a very big role in identifying and supporting the child. There are many mental health conditions, but we are going to talk about four major conditions today: anxiety, ADHD, autism spectrum disorder, and depression. So, the first condition is anxiety. So, this is the most common mental health condition in children and more common in girls compared to boys. So, even though it is a normal feeling of anxious, because you need to have a decent amount of anxiety in order to perform well. So if you are not if you don't have anxiety, you are not going to be motivated, you are not going to put your effort. So there should be decent amount of anxiety. So when it becomes disorder, when it is intense, it happens more frequently and it is impacting on everyday life, then we call it as a anxiety disorder. So, for example, excessive worry about school, they worry about friendships or family safety, and they avoid situations like going to school, social events, or they don't even want to go away from parents because they are so scared, like, by the time they come home, something will happen to their parents. So, that is excessive worry. And sometimes this worry converts into some physical symptoms. So, they experience frequent stomach aches, headaches, or other physical complaints when there is no real medical issue. And they also have trouble sleeping due to excessive worry. So how can we help child once we recognize child has anxiety disorder? So medical professional is going to help you with the diagnosis. Then if it is a mild anxiety, you can do some talk therapy, like there are some psychologists, they do the talk therapy, they understand the child, help him some strategies how to avoid or how to overcome or how to face the anxious situations. So one standard is cognitive behavioral therapy, which is like very useful treatment. So again, it's the same thing. It teaches child to understand their anxious thoughts and slowly face their fears in step-by-step way. And if it is moderate to severe anxiety, along with therapy, they might need some medications. And at home, parents can support a child with anxiety by acknowledging child's feelings, encouraging them to be brave, and gently helping them face their fears instead of avoiding them. So this is the teamwork actually. So the next condition is attention deficit hyperactivity disorder. Again, it is a very common neurological conditions. In US, it is 11 to 16% of children get diagnosis, and adults also can diagnose of ADHD. And in India, it ranges from 2 to 17%. So our brain has a lot of chemicals. We call them neurotransmitters, and that's how brain communicates from to like each like all the brain cells communicate with each other through the neurotransmitters. When somebody has this genetic condition which is ADHD, there is some chemical imbalance in the front part of the brain, and because of that, child's brain is not going to function as a typical child. So he will have trouble focusing, paying attention. He can get easily distracted, and he can be very forgetful, like poor short term memory, then poor organizing skills, so little bit messier, like backpack, messy, like his room. And they can be like excessive talking, interrupting, impatient, not waiting for the turn. And sometimes they have trouble holding their impulsion, so they might say something, they might do something it wasn't intentional, but they can get into trouble, and that can impact on their learning and developing social skills with friends, or like teachers or family members. So I have like some cases with extreme ADHD. The small children, they get suspended from the daycares, like they go to multiple daycares, and both parents are working, so it can become a big issue. So boys will have different set of symptoms, like more with hyperactivity and impulsivity, and girls will have more with focus attention. But again, anybody can have any combination of symptoms. That's why there are three subtypes of ADHD. So once we make the diagnosis, we have to do some lifestyle modifications. And if child is young, like less than 6 years of age, then we avoid medications. So usually some school modifications and sometimes therapy. And some parents also need to make their parent change their parenting styles to help the child. And then child is older than 6, then you can use either only medication or therapy or combination. And then school has like some, we call it as a 504 plan modifications. So child with ADHD, he gets to sit in the front so that he will be less distracted, he can get some extra time. And these people, like they cannot control, they cannot sit in one place for a long time, so they allowed to take breaks, and they get reminded for their assignments or homework, just to make his school life easy. We call it as a 504 plan. The next condition is autism spectrum disorder. Again, this is also neurodevelopmental condition, and it has a genetic as well as environmental. Environmental means some pregnancy complication, birth complication, or pesticide exposure, some brain infections. All this together, the brain wiring or the connections we talked about, they become very different than typically, like developing, we call it as a neurotypical, which is kind of a normal or non-autistic child. So you can see the difference because of these brain connections. They are their behavior and understanding of the things is very different, and it is called as spectrum. That means there are so many symptoms, and every child will have its own package of symptoms, so there is no comparison between one child to another. So every child is unique with their combination of symptoms of autism spectrum disorder. So in US, it is approximately 1 in 36 children, but at the same time in India, it is 1 in 250. But don't get fooled by that number, because in rural India, like it is underreported and underdiagnosed. So that's why the number is. But here it is like we commonly identify the children very early and we intervene. So there are, based on the child's age, you can see different symptoms at different. So for example, when you call the child's name, child is going to look at you. So that develops by when child becomes 12 months old. So if that is not happening, that could be the red flag. And they don't start pointing, so using finger to show something and communicating with parents like I want this or something, if they are not doing this pointing by 14 months, that could be another risk factor. Then limited or no eye contact. So usually when you interact with the children, they look at you, they smile back, and they interact. If you are seeing like child is avoiding to see into your eyes, like avoiding eye contact, that could be the red flag. Then speech delay, or sometimes they develop normal speech, like they started saying like mama, dada, whatever the age appropriate, and at some point like either 15 months, 18 months, or 2 years, they lose that skills, so they lose all those words and they become non-verbal. That could be another indication that it could be underlying autism spectrum disorder. Some children do hand flapping, like when they get excited, they flap their hands, or they do rocking back and forth, body rocking. Sometimes they do lot of spinning, they walk on their toes, and there are so many like finger flicking movements, like repetitive, they do some same movements again and again, again and again, again and again. And they also have some strong reaction to sounds. If it is like toilet flushing or vacuum cleaner or pressure cooker, they cannot tolerate those sounds, so they cover their ears. And sometimes they are very sensitive to food textures. Only they eat only two or three types of food, and then they cannot accept any other food because they are very sensitive to those things. And sometimes cloth textures. Okay, and they have difficulty with changes, so they need routine. Everything needs to be 1 2 3 4 5, like same things every day. So same blanket, same towel, same type of food, same people in the house. If somebody is visiting, they get very restless because they don't know how to address that situation. And they have limited pretend play. If you give car to small child, he's going to pretend like because he might have seen car on the road, so he makes sounds and then make car like moving back and forth. If child has autism, instead of that, he will take the car and he can like just he keeps on spinning the wheel only, so he focuses only one part of the toy instead of using the whole imagination, uh, like with the pretend play. So again, early identification is very important, because the brain is as soon as child is born, brain continues to make connections and develop and become mature, right? So when you identify early, you are with the help of therapies and some of the strategies, you can help child to go in the correct direction for the brain development. So that's why as early as you can catch these children, you can see very good results. So early support important. So starting therapy before age 5 can greatly improve child's language, social skills, and then his performance in the daily activities. So common therapies are like speech therapy, occupational therapy, sometimes physical therapy if child needs it, based on the examination. Then social skill training, and there is one behavioral therapy, the highly gold standard therapy, which is called as ABA therapy, which is applied behavioral analysis. So what they do, they evaluate the child. If child has 5 good things, they will encourage those things, and if he has something negative, they will discourage. So eventually his behaviors become better and better and more better kind of thing. And they also have some other conditions, like we talked about anxiety, ADHD, and sleep problems, and you can address them. First, lifestyle modifications, and if needed, we use medications also. Then the next condition is depression. So again, same thing, sadness, like we all feel sad here and there, but that is not the depression. But if it becomes constant for longer time and that is impacting on the child's life, everyday life, then you can call it as a depression. So there are some red flags for that also. If child feels persistently sad and crying for small things, getting irritable for not even big things, and he loses the interest in activities which he used to enjoy before. Then his changes in his appetite, either he's eating too much or eating very less, so gaining weight or losing weight. Same thing with the sleeping, either too much sleeping or not even sleeping properly, and he is very tired, low energy, feels fatigued. Then his feelings of worthlessness and excessive guilt, he always talks like I'm this is like, I don't deserve this, I'm not like, person like, who can enjoy, and I want to end my life. Or sometimes they can have suicidal ideation and thoughts. So these are the symptoms of depression. So again, just like all the mental health disorders, you can do the psychotherapy. So again, therapist is going to talk to child and understand what his feelings, and then help him to uh, change his thought process. And sometimes, for example, if child is already going through depression, and then both parents are like arguing and then fighting all the time, so that is not good for the child. So then family or couple therapy is also important, so that they all can be on the same page. And if child expresses suicidal thoughts or something, then urgent hospitalization is very very important, otherwise it can hurt his life. And then you also help them with the self-help strategies, like some physical activity, good hydration, good sleep, and some meditation, yoga, and medications also have role. So then we will talk about the sleep. Sleep is the main big foundation for the brain development. So this chart is National Sleep Foundation and recommendation of the sleep duration, and then same followed by American Academy of Pediatrics also. So newborn, he needs 14 to 17. So this is the number they require, but you can go a little bit low and little bit above also for the same thing. So toddlers, then sorry, infants, they need 12 to 15 hours. Then toddlers, 11 to 14 hours. Then preschools, 3 to 5 years, they need 10 to 13. And school age, 6 to 13, 9 to 11 years. And teenagers, 8 to 10. And young adults, 7 to 9. So as you grow older, your sleep requirement gets little bit less. So how to maintain your sleep hygiene? So sleep hygiene, first thing, we have the biological clock in our body. So you have to maintain that clock so that your body functions better. So keep the same bedtime and wake up time every day, even on weekends. I hear some of my patients' parents, they say that, like, oh, he sleeps on time, wakes up time only Monday to Friday, but weekends, I allow him to play video games or something, and child is on playing video games until 1 o'clock, 2 o'clock. So that is not the good strategy. So it doesn't matter if it's a school day, no school day, holiday, weekend, but child should be going to bed on the same time, waking up at the same time. Then you can also create one, like 4B rule, like bathing, brushing, reading book, and then going to bed. So 1, 2, 3, 4, that routine also helps children to get good quality of sleep. And make the bedroom cool, dark, and quiet. So when you sleep, your body temperature falls down. That's why if you are when you are sleeping, if you keep a bedroom like at high temperature, and again when you sleep, your body temperature goes down, so that difference makes you very restless, and you don't even know like why you are restless for the whole night. So that's why you have to make the bedroom little bit cooler and dark. Of course, like if the light goes from your eyes to brain, the brain secretes melatonin. So if light goes, then brain thinks like it is not time to go to bed. That's why it doesn't even secrete. So that disrupts the sleep cycle. That's why room should be dark and quiet. And turning off all screens like phone, tablet, video games, or like computer, whatever the electronics gadgets you use, at least 30 to 60 minutes before bedtime. And also after 6 p.m., do not use caffeine or caffeinated drinks. That also impacts on your sleep. And encourage physical activity during the day, but not right before bed, because some people, it disturbs their sleep cycle. And help children learn to fall asleep on their own in their own bed. So that is like a little bit responsibility for them. So get bright light exposure in the morning, so that the the day starts with very fresh, and you are like completely awake from the sleep in the morning. Then the screen time and mental health. So too much screen time can affect child's mental health, we all know this. And these effects are especially very strong when child is younger than 5. So you have to be very careful giving the excessive screen time when child is younger than 5. It may lead to problems like poor sleep, reduced attention, mood changes, less time for physical activity, because child is all the time on the screen. And then because of that also, real life social interaction because they are so busy with their screen, so they don't even know how to start communication or how to learn all these social skills on day to day life. And children may also become more irritable or anxious, especially with excessive use of social media or fast paced content. One after another, they keep on scrolling the Instagram reels or something that is not good for the brain. So there is a recommendation by American Academy of Pediatrics for children under 18 months, no screen except video chatting. So if they are doing video calls with their grandparents or relatives, that helps for them to develop bonding and social communication. So that is allowed, but not the screen time. For children 2 to 5 years, limit screen time to 1 hour per day of high quality content. So something educational or entertainment, but there should be adult supervision. For children 6 and older, set consistent limits and ensure screen time does not replace their sleep, physical activity, or their homework and face to face interaction. So there should not be any compromisation for those skills. And watch and discuss content together when possible. So you should know, what your child is watching on, any digital, gadgets, and create screen free zones like bedrooms or meal times. So nobody should use screen during those times, so that there will be more bonding and you can have good quality of sleep as well as enjoying your meals. And then model healthy screen habits as a family. If parents are on the screen until late night and asking children to turn their screen off, they are no, probably they are not going to listen to them. So you have to be role model for them. So then social media. So how social media affect the teen mental health? So multiple large studies have found that teens who spend more than 3 hours per day on social media compared to somebody's spending 30 minutes or less. So these children are at highest risk of developing symptoms of depression and anxiety. So that is so important for these things. So key mechanisms, like what happens with the social media exposure. One thing is social comparison. Teens constantly compare themselves to others and they say okay, I'm not doing this, other person is doing this, and then they start comparing, and that can develop inferiority complex in them. And then they also rely on likes. So they post something like picture or video and they say that, oh, why I'm not getting likes, maybe nobody likes me or something, and that creates a lot of anxiety. And social media platforms are very addictive, so they know how to get you, so they keep you emotionally charged and engaged, so you have to be very careful with those things. And time on social media replaces face to face interaction because you have all virtual friends, but in reality you don't even have friends. And then because of that also you are not doing physical activity and your sleep is also impacting, and all these retrospectively affect the child's mental health. So what parents can do: so talk to them regularly. Ask what your child sees online and how it makes them feel, and also talk about maybe improper advertises in between, then privacy, online safety, and cyberbullying. All those things you have to discuss, and it's not only one time discussion. You should keep on bringing this topic again and again, so that they will be refreshed and they will be educated. And set rules together. So create rules as per family. So keep devices out of the bedroom at night. So if child follows the rule, every night before going to bed, 1 hour before going to bed, if he turns off the electronics, then you can track those his progress, and you can reward him at the end of the month. So just he will feel appreciated, and he might do more and more. Then do not disturb at night, so they can leave all the phones or something in the living room before they go to bedroom to sleep. Aim for about 1 to 2 hours of non-school screen time daily, because nowadays all schools are using like Chromebooks. So other than that, you can just aim only 1 to 2 hours of non-school, just for the relaxation to watching something or playing games or something like online, and focus more on the balance than the exact numbers. Encourage other activities, so you can promote them for the hobbies, outdoor play, and spending time with friends, some kind of sports. And also use parental controls wisely. So as soon as 7 p.m., then they lose access to Wi-Fi or something like that. So there are so many technological. If child doesn't listen, or if you want to make that rule, and be a role model, just like we talked about, and be thoughtful about giving a phone. So what age, if you feel like your child is mature enough to handle smartphone, you can buy smartphone for him. But before that, if you feel like your child is not ready, but still you want your child to have phone for the communication, especially for the phone calls for the safety purpose, you can buy flip phones instead of smartphone. So what are the red flags, or when should parents get alarmed or alerted? So if child is not speaking by 18 to 24 months, like having only few words, that is a speech delay. Then if you notice child is not giving good eye contact or not even interacting, when you look at the child smiling, he's not even smiling you back, that kind of stuff. Then frequent temper tantrums beyond expected age, and for example he's not behaving as per his age, he is behaving immature for his age, then that could be underlying some neurological or mental condition. If child has difficulty focusing compared to peers, like rest of the kids are doing good but your child is not paying attention and he's disturbing the class, and you are listening, hearing something from his teachers, then you should get alerted for that. Excessive screen dependence, so you have to make sure your child is not addicted to the screen. Then if he has sleep disturbances, either he has trouble falling asleep or he is waking up multiple times, or if small child is snoring, that is not a good sign, so you have to get it addressed by medical professional. Then if any mild delays in milestones, if child is not walking on time, talking on time, socially not playing with other kids, or if you notice anything like okay, why my child is not doing this, or why he's doing this, in both cases you should get them checked. Then school concerns, if his academic grades are going down, so maybe there is underlying learning problem or maybe ADHD. Then if teenager is getting like socially withdrawal, so he's, as soon as he's coming from school, he's locking himself in the room and he's not smiling, he's not participating in any fun activities, he's not sleeping well, then that should alarm parents, maybe there is underlying some depression going on. And aggression causing harm to others, if you are getting complaints from school like this your child was very aggressive and something, that is also another alert for the parents. If child is exhibiting severe anxiety or panic attacks or some phobias interfering with daily life, then you should get alarmed. And if child is persistently sad, withdrawals, and then if he is showing signs of depression, then you should get him checked. So once you address all these medical or mental health issues, how you can support child at home. So there are certain pillars for the healthy brain and body development. So the first thing is diet. So healthy and balanced diet is very important. So include more proteins, eggs, milk, chicken, yogurt, beans, nuts, depending upon whether you are vegetarian or non-vegetarian, you can have like lot of sources for the protein. Then give fresh fruits and vegetables daily, and prefer home cooked meals over the packaged foods, because which has lot of chemicals and preservatives, to maintain the long shelf life. Then limit junk food and sugary drinks as well as artificial colors and artificial sugars. Use healthy snacks like fruits, nuts, or sprouts. Then second is good hydration. So good hydration is important in general, and at the same time, if child is active in sports, then you have to make sure he's well hydrated, and in hot weather situations also. So this is the requirement based on the age. Then physical activity. So at least 60 minutes daily of active play. So for small children, you can do like more tummy time, on other interactive play, and you can spread it throughout the day. Then if it is a toddler and preschooler, more than 3 hours of physical activity, walking or free play, and you can also split it into the day as the day goes. Then kids 6 years and over, 60 plus minutes. And then in those things, you can encourage them for running, cycling, swimming, or some kind of sports like soccer, football, some structured sports activities like karate, taekwondo, yoga, or even dancing, or those things. So This physical activity improves focus, improves mood, and overall mental and physical health. So you just have to encourage them. Then screen time, we just talked about all the details. So this is again recommendation by age. And the last thing is consistent parenting, because the child spends most of the time with their parents. So consistent parenting is important. Otherwise, mother is saying something and father is saying something different. Either child gets confused or he can take that against the parents and then play games, so to get whatever he wants. So it has to be like both parents should be on the same page. So set clear rules and routines. So child should know what is expected, what should be he doing and what he should not be doing. So he should know it very clearly, and be consistent with rewards and consequences. For example, one time he doesn't do something and he gets punished or something, and second time for the same type of action he doesn't get punished. So he will get confused, which is true, why I didn't get punishment and why I did got the punishment last time. So it has to be consistent. Same with the rewards also. And always use positive reinforcement. Every child has some strengths and some weaknesses, so you always have to encourage about the strengths, and then celebrate and acknowledge and reward them, so that they will focusing more on the positive thing. And spend quality time daily, and encourage open communication. So you have to develop bonding in such a way child should be able to feel comfortable discussing any concerns he has. So take home points for the parents: get the correct information from the reliable sources. So whatever information you see, on any social media like Facebook, Instagram, WhatsApp, because everybody's doctor there and everybody's giving their great advices and making AI generated videos which looks very real. So you have to be careful. There might be some correct information, but when you are not sure whether which one is correct, which one is wrong, it is better not to believe any of those things, and then get information about the from the proper resources. And early attention is better than late reassurance. So trust your instinct. If you feel something is wrong with my child, it doesn't hurt to get evaluated and just check. If it is nothing there, you will get reassurance. If something there, it will get addressed. So in both situation you have win-win situation. And please do not fear of what will people say. So because your child is your priority, not people. Okay, people are going to say irrespective of what you do. So first focus on your child. Your child should be your priority. So seeking help is not a weakness. So whenever you need, you just go and get the professional help. And so early intervention can significantly improve long term outcomes. So awareness and acceptance can overcome stigma and open doors to timely care. I have some families who come once their child got diagnosed of autism. They stopped meeting, any going into any social gatherings, because they said, if I go there, people are going to question about my child's diagnosis or something. So I always encourage them, on the contrary, you should go there, and if somebody asks, just give good eye contact to them and say that yes, my child has autism. That's it. Only one time. Once you break that wall, you are going to be comfortable, but don't keep yourself socially isolated only because your child has some mental health disorder. I think that was the end. So thank you for listening, and if you have any questions, I am available.